Magnolia Regional Medical Center report. Ms. Margaret, if you'd come to the podium, please, ma'am.
Thank you, Mayor. It's a pleasure, as always, to be able to address this group and to tell you about our hospital. I did provide you with a new community benefits report that covers our last fiscal year that began 10/1/14, ending 9/30/15. So that's what we'll be talking about mainly. I want to thank two of my Board of Commissioners that are present today, with Molly Burns as our chair and Steve Nipper. Also on the back of this, you have our Board of Commissioners that served during that fiscal year. We did lose Wanda Rhodes and Randy Reed went off the board, and we thank them for their years of service. And we're happy to have Shawana Reed and Angie Eves to join us with our Board of Commissioners. I'm going to refer to a few things in the little booklet, but mostly this is just for you to take and read at your own convenience. I just want to take a minute to talk about a community benefit report and kind of what that's about. It's really to tell the story about the benefit that the hospital that we have here in Magnolia, how it benefits the community. We have 229 full-time and part-time MRMC employees that are friends, families, relatives, neighbors, and a large part of the benefit to this community. They participate in health fairs, organizations such as Health Coalition, Southern Christian Mission, StuPot, Rotary. They do school physicals, and they participate in local parades, among just a few of the things that are listed within the little booklet. Employees educate the community in health through local health fairs. We do a MASH program, which is a senior student 10 slots that we have students come into the hospital that we're trying to encourage people at that level to go into health profession. We have a 2 weeks where we actually train them, let them shadow whatever health professional they want to shadow. And it's a very intense program for 2 weeks. And this is our third year. First year we had 10 slots and 11 people applied, so we went ahead and had 11. The second year we had 10 slots and 13 applied, so we kept 13. This year we had 23 applied, so we did have to go back to the 10. So we're happy that it's growing and the word is out that they're getting something out of that. They also do TB shots for organization, teach CPR and advanced cardiac life support classes, participate in the training of future doctors at our hospital, nurses, physical therapists, respiratory therapists, and labs. We have people, and that's listed in the book as well, about all the different colleges and universities that send students to us. We MRMC employees have a payroll last fiscal year of $11,719,872. That is money available to put back into the economy of our city. Healthcare is changing, and it is a difficult time for many small rural hospitals. Some of since the Affordable Care Act came into being in 2010, we have had 69 small rural hospitals close. We don't want to be one of those, so we are working very diligently to make every effort we can to keep our hospital very financially viable and to also continue to provide the benefits. If you'll take a look on the inside cover of the benefits report that I gave you, I wanted to just briefly go over the financials that we had that began 2014 to 9/30/15. We had implemented, at the last time that we talked, we were excited about some of the things that we were doing. We'd implemented the hospitalist program, which is what most hospitals are doing, most all hospitals are doing now. And we had the residence program. We had assumed the management of the Murphy Clinic. We had hired another surgeon. So we have a lot of things going for us. And we had one of our record revenue producing years. In that particular year, our patient revenue was 49.7. With other revenue, we had a $50.2 million revenue. However, if you'll look in the box about revenue deductions from revenue, we have contractual allowances. And these are like your Medicare, your Medicaid, Blue Cross and commercial insurance. And we have, to work with them, and for example, if we have a procedure that costs $100, we may, sometimes we can negotiate, but most of the time it's non-negotiable. They say we will pay you $50 for that procedure. So the other $50 is a contractual write-off. So our contractual write-offs of our $50 million from those three areas, Medicare, Medicaid, and insurance, was $25.7 million. Bad debt expense is another one that's listed there. That's a little over $2 million. This is for people within our local community who utilize our hospital that had no means of paying. They had no Medicare, no Medicaid, no private option insurance. They had nothing. Sometimes they couldn't pay the deductible. This is the amount that we wrote off to be able to still take care of those patients within the community. There is another area called Medical Assistance Program, or short we call for MAP, and we are required by law, because we are a nonprofit hospital, that we are to take care of a certain amount of our patients free of charge, but you don't get to count the other two costs. This is a separate one, and so here is another group of people within our community that applied for and were eligible to receive medical assistance program, and that was $601,000. So we had a total deduction out of our $50 million of $28.3 million. What the remainder is what we have to operate off of, and you heard me say that our payroll was almost $12 million, and with benefits it's probably closer to $14 million. And so the remainder is again what we had to operate with the hospital. Our expenses exceeded that $25 million, little $25 million, but our depreciation expense coming from the depreciation that we take from the hospital, from the new hospital, from the bonds, is $2.6 million. So when you take that off of the amount that we had less expenses, we actually had a negative $138,000, $750. So we felt that that was a fairly good year. Now, other things come about and came about in the year because we had some takebacks from the federal government. People are looking for ways to get money. So our state Medicaid decided that the process that we had been using to bill and collect money in our labor delivery area had been incorrect for 5 years. And so we were asked to pay $1.5 million back last summer. So we paid the $1.5 million back. We also had a new audit company that came on board, and they kind of cleaned up the books and kind of adjusted some of the payback for several years, and that allowed to another probably about $500,000. So we lost about $2 million from that payback. So our cash is declining, but we are trying to address this for this fiscal year. And we have gone into what we call a financial recovery plan. And our goal is by the end of this fiscal year, which will be the end of September, we are holding off all of our capital expenses, and we have made several commitments to reduce the payroll and supplies, so that we can get ourselves back into where we want to be by the end of the fiscal year. We're also working with some consultants that have come in. We've got another one maybe that will be in to talk with us in May, that will help us to come up with a plan to move forward, because they're, as I said earlier, healthcare is changing. We want to change the way we have to be able to stay viable financially. So we do a wonderful job. I think our staff is wonderful. We provide a lot of services to this community, and we want to be here for many, many years to come, and we want to make sure that that's happening. Are there any questions that I can answer for you?
Margaret, I got one. How much is this $25 million, $26 million contractual adjustment is because of voluntary? Some of that because of voluntary.
We had that, James, even before Obamacare. I mean, that's always been there. I a little bit more because they have insurance. Prior to that, it all went down into the bad debt expense. So really what it did was change where we put it. We put it, instead of a bad debt expense, it increased our contractual write-offs. Because and also some of the bad debt, because many of the people they take the low, premium and high deductibles, and they can't meet the deductibles, so sometimes that's a write-off.
Your bad debt, then running around $2 million?
Yeah, that's what I'm saying, it has reduced our bad debt, but increased the contractual write-off.
Any other questions for this? Thank you. Wastewater